Are you all set? Let's get started.
What is the maximum allowable white blood cell count per unit in leukocyte-reduced RBCs, as per ASCPi standards? The correct answer is C. Which blood component is given to patients with symptomatic anemia and severe allergic or anaphylactic conditions? The correct answer is C. Washed RBC. To prevent transfusion-associated graft versus host disease, what blood component is usually given? The correct answer is D. Irradiated blood components. Which of the following blood components contain all of the proteins necessary for blood clotting? The correct answer is C. Fresh frozen plasma. What is the shelf life of frozen red blood cells once thawed? The correct answer is A. 24 hours. Which centrifugation technique is commonly used to isolate platelets from whole blood? The correct answer is B. Light spin followed by hard spin. Which of the following blood components contain all coagulation factors? The correct answer is C. Fresh frozen plasma. Thawed fresh frozen plasma is stored at what temperature and should be transfused after how many hours? The correct answer is A. 1 to 6 degrees Celsius in 24 hours. What is the blood component used for reversal of Coumadin and warfarin overdose? The correct answer is B. Fresh frozen plasma. According to ASCPi standards, cryoprecipitate must contain how many units of AHF and how many milligrams of fibrinogen? The correct answer is B. 80 units and 250 milligrams. What blood unit is commonly given to patients with von Willebrand's disease? The correct answer is D. Cryoprecipitate. What is the required minimum hemoglobin level for an autologous donation according to ASCPi standards? The correct answer is B. 11 grams per deciliter. How should the blood be handled or processed during the preparation of platelets from whole blood? The correct answer is C. Cooled to 20 to 24 degrees Celsius. If the hermetic seal of a unit of RBCs stored at 1 to 6 degrees Celsius is broken, how long does the unit remain viable for transfusion? The correct answer is C. 24 hours. At what temperature should apheresis platelets be kept during transportation? The correct answer is A. 20 to 24 degrees Celsius. At what temperature should leukocyte-reduced red blood cells be kept during transportation? The correct answer is B. 2 to 10 degrees Celsius. Ambient air temperature of platelets stored on a rotator must be recorded every how many hours? The correct answer is B. Every 4 hours. Apheresis platelets should be stored at what temperature? The correct answer is C. 20 to 24 degrees Celsius. Cryoprecipitated and thiomophilic factor should be stored at what temperature? The correct answer is D. Negative 18 degrees Celsius or below. What is the critical pH level for apheresis platelets to maintain their viability and function throughout their storage period? The correct answer is D. 6.2. To prevent HLA-low immunization in recipients, which of the following blood components should be administered? The correct answer is B. Leukoreduced blood components. Which of the following conditions is most likely to occur in a newborn whose mother has been isoimmunized to platelet antigens? The correct answer is A. Thrombocytopenia. What is the maximum storage duration for whole blood preserved with a CD, CPD, or CP2D? The correct answer is A. 21 days. Rejuvenated and washed RBC store at a temperature of 1 to 6 degrees Celsius should be transfused within. The correct answer is D. 24 hours. How does the storage duration affect the levels of 2,3-diphosphoglycerate in stored blood? The correct answer is B. Decreased levels. What blood type can be given to a patient in an emergency situation where the patient's blood type is unknown? The correct answer is D. O negative. Screening cells and major cross-match are positive on immediate spin only, and the autocontrol is negative. Identify the problem. The correct answer is A. Cold alloantibody. What type of red cells is acceptable to transfuse to a O-negative patient? The correct answer is C. O-negative. What does a minor cross-match consist of? The correct answer is C. Recipient red cells and donor plasma. Which of the following is an acid elution stain that is used to quantify the amount of fetal cells present in the maternal circulation postpartum? The correct answer is A. Kleihauer-Betke stain.
That's a wrap. Tally up your scores and let me know how you did. Make sure to like, subscribe, and hit the notification bell so you never miss another quiz video.